We're here at Real Plastic Surgeons, Real Answers, and we hit the streets to see what patients really want to know about plastic surgery.
I love the look of the fuller lips, but I don't want to go too extreme. And does it really make you look younger?
Well, we've heard that before. Brian Reagan, you actually have done some groundbreaking work in lip augmentation. So what do we say to that patient?
I'm not sure full lips make you younger. They may make you look a certain way. I tell the patients that there are several different options that you can do to increase the volume of your lips depending on what is your downtime and what is your investment.
I mean, if your lips are really not full, but your chin and your neck is pretty full, maybe just a little lipo of that neck and no fat in the lip might be a... I mean, sometimes a patient comes in
She
with...
want her lip done.
I know, but sometimes a patient comes in and says, gee, doc, you know, I want a rhinoplasty, and you're looking at her ears, and it might not necessarily be the right operation.
I like to offer things to patients like that to treat the problem they're coming in talking about. And lips, I mean, where do women get the idea that big lips are better? They look funny. You look like a weird movie star if you have big lips.
No trout lips.
That's right.
Yeah, what is that? What is it? You read
Trout lips.
Trout pout.
Big trout pout. No,
what is that?
It's like the Hollywood look. We hate it. We hate it. As
it gives us a
plastic
bad
surgeons,
reputation.
Absolutely.
Yep.
There's more misinformation out there than real information.
The good ones, again, are the ones that you don't notice. Right. You do them, they look great. Wow, she looks good. Not, oh, look at her lips. You see them coming from the next room.
So, Christine, so for lip augmentation, what do you offer patients?
I usually use hyaluronic acids. I haven't used fat much there. I just like standard, you know, Restylane, Juvederm. I like to make the lower lip a little bigger than the upper lip. But people don't realize that. They want a huge upper lip. And I have to show them picture after picture, model after model, that this looks natural, not a big upper lip.
Dan, you probably like fat, I assume?
No, I agree with Christine. I think less is more in the lip. I think that...
Be honest.
I am. I think the lip is notoriously bad for fat. It's mobile. The fat doesn't get a blood supply. I think it's one of the areas where fat, it's a paradox, great blood supply, but high mobility, low yield.
So I do a lot of fat to the lips, but usually it's in patients that are doing other procedures to the face and they're willing to tolerate a little bit more swelling. If someone wants very little or no downtime, then I use the hyaluronics.
What about this obsession women have with the fine lines on the upper lip? Does that drive you crazy? Oh, I see these little fine lines on my lips.
Mirrors.
Exactly, that's what I ask them.
Look at these mirrors every single day.
Right. I'm like, at conversational distance, I don't see those
So do you
lines.
tell them just not to look in the mirror?
Get rid of your
get
mirrors.
rid of it. Throw it in the trash.
Well, that's what we say. But the best really thing of that is laser resurfacing. For fine lines and wrinkles, nothing beats laser surfacing of the upper lip.
What if
Especially
they have
if you
volume?
combine it with increasing the volume to the lips.
Yeah, you need to combine it, I think.